It's really to get the patient to be symptom-free, live a normal life, not miss school or work, and be able to exercise and have a normal life. Would anyone disagree that that's the goal, not just in asthma, but in treating any condition? Of course, nobody disagreed. So I said, and are there side effects of some of the conventional medicines we use, like the inhalers, like steroids, and so forth? You know, whether they're frequently seen or not, are there side effects? And everyone said, well, yes. So I said, well, then why logically, if you could give a person medicine that has no side effects and keeps them from using medicines and allows them to live a normal, fulfilled life, what's the downside? Do you know what I mean? And that was how I started the talk. And of course, once I mentioned I was talking about homeopathy, then of course everyone jumped up and didn't like that at all. But I just said, logically, I think they're good choices. And so for that reason, as you know from taking the courses in homeopathy, requires quite a bit of learning, quite a bit of time.
And what's interesting, I explain it to patients similar to allergy shots. I kind of correlate it to that, where if you have an allergy to ragweed, you go to the allergist and they start giving you injections of ragweed in small amounts till you build up your immune system. And I tell them it's not exactly like that,
right.
But it's very similar.
Right.
And I find that a lot of OBGYNs send their pregnant patients because they don't want to touch them. They don't want to touch them when they have a sinus infection or a cold, and they come in and very often they don't really need an antibiotic. They just need something because they have difficulty mobilizing their secretions, clearing their heads. And the homeopathy works so well that I had one patient come in the very next day, because when she came into the office, she was kind of really sounding like this. She comes into the office and the girls call me out of a room and she says, I just wanted to come and show you, listen. And I was like, oh my God, this was just in one day. And she was so happy. It's safe. And I know it's safe because homeopathy was out when I was a kid as Humphreys. Was the company, and they had it in every pharmacy. And so my mom always had Humphreys that she would give me in her pocketbook, which I one day went into and just ate the whole bottle of Humphreys. So I'm here to say that I know that it's safe.
Well, it's funny you mentioned that, because one of the questions on the homeopathy exam is a little girl has just gone into her mother's pocketbook and taken a whole bottle of homeopathic medications. So what should you do? A, induce vomiting. B, call poison control. C, go to the store and buy another two because it can't harm you. And that's really true for homeopathic medications. I mean, there are some herbal medicines that, in fact, can be quite toxic. But homeopathic medicines, by the virtue of the fact that they're defined as infinitesimally diluted substances, have a huge degree of safety, a huge margin of safety. As a matter of fact, if you go on the National Institute of Health, they have a website about CAM, complementary alternative medicine. Under homeopathy, they point out that there have never been any substantiated overdoses, toxic effects from homeopathic medications.
And now people don't realize, I think people are under the impression that homeopathy is something new and just kind of new age, but it's not. It's been used in Europe, specifically in Germany, for many, many years.
Oh, yes.
And we used it here in the United States until the emergence of antibiotics, I believe.
That's correct, and surgery and anesthesia. Interestingly, homeopathy came to prominence in the United States in the middle 1800s when there were waves of cholera epidemics. And at that time, there were no antibiotics. Antibiotics can actually help cholera, or intravenous fluids, of course, which is one of the mainstays of treating any kind of infectious colitis. But homeopathy did very, very well. And that got some supporters of homeopathy really funding to build homeopathic medical schools at that time. But what's most interesting about the history of homeopathy to me is, and it's very topical these days, is the flu epidemic of 1918, 1919. And at that point in time, there were not very many, well, the only medicine that was useful in treating the flu was aspirin. There were no antibiotics, there were no antivirals, and it was the only conventional medicine that used was aspirin. And it turns out that aspirin was not the right thing to use. You know, if doctors were able to lower patients' fevers, then with some aspirin, well, they figured more would be better. Unfortunately, as we now know, high doses of aspirin tend to cause the blood to have difficulty coagulating. That flu was had a tendency towards bleeding, and in fact, patients who are on high-dose aspirin therapy did very poorly, and there were many deaths in conventional hospitals because of that treatment. Conversely, homeopathy, the medicines that we use today are the same medicines that we used at that point in time. The medicines are extremely useful for the flu, and at that point in time, the mortality rate in homeopathic hospitals was actually quite low. In some cases as low as 1 to 5%.
Well, I can tell you, I use the Oxycocicillium, and I use it, I'll do 1 tube once a week during the whole flu season. Because I come into contact, as well as you do, with, you know, patients who, can you cough? And it's right in your face, and you're surrounded by people who are really sick. And patients ask all the time, how come you never get sick? And one of the things I really think makes a difference, besides vitamin C and the other things I do and getting enough sleep, is basically the Oxycocicillium. And if I do feel like I'm coming down with something, I'll do 3 tubes a day, and I knock it out. And I don't, knock on wood, get the
It's
the
true.
flu.
I actually use it for myself, and I use it for the family. Of course, having built up antibodies for practicing for 25 years helps too, because I get coughed on an awful lot.
Yeah. Now, the whole interview for a homeopathy patient is different than the regular, you know, what's your family history, and okay, good.
Yeah, well, no, that's part of it too. The homeopathic, your family history is very important, but in homeopathy, it's interesting to me also because you get more, when I say intimate details, I mean like more specific to the individual information. As a matter of fact, Hahnemann said that if you can understand what about this illness has changed something in the patient, what symptoms are unique and striking, okay, and completely different in this individual, you'll be able to understand what medicine to prescribe. And in fact, that has really been very enlightening for me in practice. When I have difficult cases, I'll often ask a question that I didn't used to ask in the past. I'll ask something along the lines of, at the time your symptoms developed, what was going on in your life? And I have to tell you, I've been stunned by the helpful information that comes out. You know, people will recall either a physical trauma or an emotional trauma. Really, really very enlightening for me. And it works 2 ways. First of all, in a homeopathic prescription, it works because it gives you good information. But you know something? When you connect with a patient in that way, where you're not only interested, but you're in sync and you're kind of ferreting out information that helps the patient understand himself or herself better, I think it leads to a better result with any treatment, specifically homeopathy.
Yeah, I agree. I think integrative physicians have that ability to touch their patients in that way. I can't tell you how many times somebody will make an appointment for a sore throat or a headache or a sinus infection, do my thing, and just before I leave, I look at them and go, are you okay? You don't seem right. What's up? And the next thing you know, they're crying, they're going through a divorce, and you know, and you sit and you hold hands and just go through things. Or for instance, I had a patient yesterday who said she had the sensation of feeling really anxious and just, you know, she's retired and life is good and her husband is great. And I happen to know that she's one of these high-strung ladies, and I go, well, now that you're retired, what do you do? She said, well, I go to the gym. Well, what else do you do? And she's like, nothing. And I said, well, you need to volunteer. You need to find something else to feed your soul. And she was like, you know, you're right. I'm like really bored, and my husband is happy to stay home, but I'm not. And she left like, well, I'll be back in 3. I told her your assignment is in 3 months. You need to find something to do, to give.
Well, one of the most useful applications of homeopathic medicines is, in fact, as you said, on the emotional, psychological plane. for anxiety, for frustration, you know.